what's all the fuss about exercise and cancer? Well, over the past decade, there has been what I consider to be a plethora of new research in the field of exercise in sports medicine, in health promotion, in epidemiology, and areas of cancer survivorship. There are new relationships with oncology centers and exercise programs. I've been keeping a close eye on the Livestrong Foundation and their relationship with the YMCAs. I just read in one of their industry reports last week that they've put in about $480,000 over the past few years into YMCA-based grant programs, so cancer patients can exercise in those types of facilities. And I've also seen that there's more impact on longevity than almost any other type of treatment program that's in the industry. Again, I've mentioned the fact that I've done a 10-year follow-up program, and I want to see that other people can actually have success performing exercise with cancer patients over many years, as opposed to what we consider a general study, which may be 10 weeks, 20 weeks, etc. So what's all the fuss about exercise and cancer? Well, the first area that I want to discuss with our listeners is some of the problems that we're starting to see with traditional oncology treatments. One of the areas that I like to read up on almost every day is what's going on in cancer care. And I just heard a reasonably disturbing report here recently that almost 40% of pharmaceuticals produced for the American market are now being manufactured in China. And I think that there are some issues with quality control. And I also think that there are issues with, and as I have in my first bullet point here, the continual increase of the expense of cancer therapies. For those people who are familiar with Taxol, it has been a staple of chemotherapy for many years. A few years ago, a new drug called Abraxane came on the market, and it cost $4,000 per dose, and it actually has no more efficacious benefits in terms of survivorship than the use of Taxol, which costs 25 times less than the use of Abraxane. My second bullet is about the terms of non-efficacy in terms of its impact on health. And what a lot of people may not know about cancer treatments is that if there are some effects in terms of reducing the cancer tumor, if we look on the left-hand side of the screen, some of the long-term side effects can be, actually secondary cancers. One cancer may cure a breast cancer, but it may cause a cancer somewhere else down the road. There are issues with premature aging and also with organ damage over time. And the last thing is about longevity and survivorship issues. And as cancer patients are living longer and longer, if we look at the Philips Innovation for Oncology segment here with the follower Peter, he asked the question, should cancer patients qualify for disability? In other words, they're living longer, they're not feeling well, we need to pay for them to be on disability. And so it begs the question, where do we want our money to go? Do we want our money to go to long-term disability programs for people, or do we want to, at some point in the future, have cancer patients work out in health clubs, medical fitness centers at a lower cost and actually not have them be considered a disabled person? So what I'm trying to do when I talk about cancer therapies is look at things as a whole. I know that cancer patients need to have certain types of chemotherapies, but what we're seeing is there are a lot of issues that are involved with this. The drug maker Pfizer just pulled off a Mylotarg, which has been on the market for 10 years, and what they found in the latest study is that when they compared survivorship rates with this drug to control people who were taking no treatment at all, they found that 4 times the amount of people were dying. So like I say, in medicine right now, we seem to see that there are some good things happening and some bad things happening. And when I lay the foundation here, I'm not trying to wag a finger at oncology per se, because I know that they're hard-working folks, but I know that they also see that there are issues with just having one type of treatment, one type of therapy, which is radiation chemotherapy. It's that for everything that it may help, it may actually cause some things well. And so as I segue into that, I actually think that exercise is a great value. Over the last 16, 17 years, I've seen programs all over the country, and here are some of the things that I think are important about why I like exercise. A, it is a very low cost to produce a program. If we looked at the cost per patient per year, it may be less than $1,000 to participate in a program. And for the most part, they have great outcomes, whether they're psychosocial or they're physical. So if we look 10 years ago at the British Medical Journal, they begged the question, does physical activity prevent cancer? So they were very interested back in the 90s about prevention, and over the years, we've seen that they've actually looked at it from the standpoint of survivorship. So very recently, we look at the end of 2011 to the National Cancer Institute's bulletin, their spotlight, and I quote, guidelines urge exercise for cancer patients and survivors. So we've looked at